Aphasia is a language disorder caused by brain structure damage affecting speech functions. It is commonly triggered by stroke and other factors such as brain injury, dementia, and mental disorder. People with aphasia can face various communication challenges due to the limited language processing and comprehension capabilities. Depending on prominent symptoms and severity, aphasia can be classified into the 8 types. For instance, damage to Broca's area keeps the meaning of words intact but makes it difficult to speak fluently. On the other hand, people with Wernicke's aphasia often speak fluently, but their speech can be confusing and doesn't make much sense. Clinically, a detailed diagnosis of aphasia type is important for proper treatment. However, the traditional assessments are known to be time-consuming and costly. Also, little attention has been paid to developing a model for diagnosing the different types of aphasia. People with aphasia often rely on nonverbal communication techniques, especially gestures, as an additional communication tool due to the difficulties in word retrieval and language errors. So the same word can be interpreted differently depending on the accompanying gestures for different aphasia types. For instance, people with Broca's aphasia tend to use more meaningful gestures, while those with Wernicke's aphasia don't rely much on gestures for help. So the meaning of the specific word from people with Broca's aphasia may have more latent information. So, utilizing both speech and gesture information is crucial in classifying aphasia types. In order to capture interconnections between modalities, recent studies used transformer-based fusion approaches that can extract contextual information across modalities. But applying these methods is quite challenging in combining 2 different modalities, speech and gestures. These were usually built up on emotion recognition or sentiment analysis benchmarks, mainly consisting of facial information. But people with aphasia struggle in using faces due to the impaired emotion processing. Also, these models tend to consider only a single link across the modalities, which means they might link joy-related words to only smiling faces, but there can be multiple links across the modalities depending on aphasia types. To address these challenges, we propose to apply a graph neural network to generate multimodal features for each aphasia type. A unique graph structure can help distinguish diverse patterns by learning the correlations between speech and the corresponding gestures of different aphasia. We first construct a heterogeneous network that represent the relations between speech and gesture modalities based on their co-occurrence. Then, graph encoder extracts 3 node embeddings for disfluency-related keywords, audio, and gesture tokens by aggregating information from different sources. Before fusing the finer modalities, we update the pre-trained embedding weights based on the aggregate disfluency representations from the graph encoder. Then, the word embedding layer can generate gesture-sensitive text information. According to the experiment, we found the proposed model outperforms all the baselines regardless of the aphasia types. And the speech gesture graph encoder and updating word embedding layers can help better performance. Our proposed model can also provide interpretability based on multimodal attention scores. We demonstrate gesture-sensitive text features can help the multimodal fusion encoder to assign different weights to each modality by considering the meaning of words. The contributions of our study can be summarized as follows. First, to the best of our knowledge, this is the first attempt that uses gesture and speech information for automatic aphasia type detection. Our analysis reveals that gesture features play more critical roles in predicting aphasia types than acoustic features. We find that applying the GNN can effectively generate multimodal features by capturing relations between speech and gesture information. And also, the qualitative analysis can help clinicians understand aphasia patients more comprehensively.